Do you wake up in the morning feeling tired even though you thought you had a full night's rest? Are you falling asleep, maybe even behind the wheel of your car? Do you snore at night? Has anybody noticed that you've stopped breathing when you're sleeping at night? Well, if so, you may have sleep apnea. What is sleep apnea? Well, the word apnea itself means no air. So sleep apnea is when you're sleeping, you're not breathing well, or you're maybe not breathing at all. But the majority of the people that suffer from sleep apnea have what we call obstructive sleep apnea. As you can see in the diagram, the upper airway is made up of soft tissue and your jaw, which is on a hinge, essentially. While you're sleeping, your whole body relaxes, and part of that relaxing is your upper airway can actually collapse on itself. As you can see in the diagram, once again, the jaw drops back, and the tongue and the soft tissue of the palate will obstruct your airway. Partial obstruction is, of course, where snoring comes from. That's the noise that's made from a partial obstruction. But if it totally obstructs, it can actually stop air from moving in and out. Not only are we concerned about whether or not air is moving in and out with sleep apnea, but we're also concerned about what's happening on a chemical, hormonal level during sleep. One of the hormones that is released during certain sleep stages is called leptin. Leptin is a hormone that helps control our appetite. If you are not sleeping correctly, and if you are not able to release, your body's not able to release leptin, what happens is we tend to crave foods, and we tend to crave foods that are not good for us, like sweets and sugars and that kind of thing. We need to correct the sleep apnea so that we don't have the constant disruptions to our sleep. These disruptions to sleep, where do they come from? Well, they come from the fact that your body is struggling because it's not moving air. They are connected. So you want to keep the air moving in and out of your body so that your body then has a chance to go into the proper sleep stages and also for the proper length of time. If you're experiencing any of these problems in your everyday life, it might be time to speak to your doctor about whether or not you need a sleep study.